Hello and welcome tonight, everybody. My name is Jess Posner. I am the Virtual Programs and Membership Director at the YMCA of Central New York. Thank you so much for joining us this Cinco de Mayo, and for our Star Wars fans in the audience, I hope that the 4th was with you yesterday. It is my pleasure to welcome you tonight to the first event in our month-long speaker series focusing on mental health awareness. Before we begin, I'd like to offer just a little virtual housekeeping. You will notice that you are automatically muted when you entered. This is to help maintain a pleasant experience for all. Please do keep your sound muted, but feel free to use the chat box at any time. I will be monitoring the chat box to collect questions and comments for the question and answer session following Dr. Draker's presentation. I will also be spotlighting our speakers tonight, which will highlight them on your screen when you have the presenter view selected. To turn this presenter view on, please click in the upper right-hand corner of your Zoom window and select Presenter View. We are recording this session, and any publicly shared version of that video will include my and Dr. Draker's feeds only. So feel free to have your video on or off, adjust your names that appear on the screen as you would like and as you are comfortable. And now I would love to introduce tonight's program and our speaker, the esteemed Dr. Robert Dracker. May is Mental Health Awareness Month. Since the beginning of the COVID-19 pandemic, the Center for Disease Control has issued studies that reflect that US adults reported considerably elevated adverse mental health conditions associated with COVID-19. Younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers reported having experienced disproportionately worse mental health outcomes, increased substance abuse, and elevated suicidal ideation. As we know, this pandemic doesn't only impact the mental health of adults, but children as well. Tonight's guest, Dr. Robert Dracker, is a brilliant physician whose viral, impassioned, and honest reflection of the impact that he is witnessing on children's mental health resonated with parents and caretakers across the internet. Dr. Robert A. Dracker is the founder and medical director of Summerwood Pediatrics, previously known as North Area Pediatrics since 1993, with offices in Liverpool and Camillus. He is an extremely accomplished physician, and I'm really going to just offer a highlight of his bio here. And he is board certified in pediatrics, transfusion medicine, and a certified physician investigator. Dr. Dracker is certified in managed care medicine and in quality assurance and utilization review with subboard certification in managed care review. Dr. Dracker was the president of the Onondaga County Medical Society from November of 2009 through November 2010, and he is also the chairman of pediatrics at Community General Hospital in Syracuse. Dr. Dracker served as medical director of transfusion medicine service at University Hospital for 5 years, prior to his current position as founder of the medical director of Summerwood Pediatrics. And he also founded Infusicare Medical Services, which provides adult and pediatric patients with current, standard, and emerging outpatient intravenous therapies. Dr. Dracker has been actively involved in the area of cord blood banking and stem cell transplant. He was the medical director of the BioSite Corporation, which facilitated the first cord blood transplant in the United States, as well as being the medical director of ViaCord in Cambridge, Massachusetts, up until May of 2007. Dr. Dracker served on the New York State Governor's Council for Blood and Transfusion Services for 17 years and has been the chairperson and now member of the Hematopoietic Progenitor Cell Committee. Sorry for butchering that. For the New York State Department of Health, as well as the co-chairman of the Heart, Lung, and Cancer Committee for the Medical Society of New York State. He is also a founding board member of the National Alliance for Biotherapeutics. Dr. Dracker is on a number of professional and charitable boards and has presented worldwide on many topics regarding pharmaceutical parental therapies, clinical research, and a variety of pediatric policies and stem cell therapy. He is actively involved in both ongoing basic science and clinical research, particularly involving vaccine therapies, and has well over 50 abstract and article publications. He is a friend of the Y of CNY, and as I can tell from my interactions with him in preparation for tonight, he cares very deeply about all of his patients and their families. So Dr. Dracker, without further ado, I now turn the virtual stage over to you, and I will spotlight you for everyone. And you can go ahead and unmute yourself and begin screen sharing when you are ready.
All right, I'll try to, do I share the screen? So we'll do that, right? Not yet. Hold on a second. 1 second, Jess. Too many screens open.
Take your time.
Can you see it, Jess, or not
Yep.
yet?
Yeah, we can see your screen, and just go ahead and hit play, and then you'll be good to go.
All right. All set?
All set. Thank you.
Great. Well, it's a pleasure being here with all of you tonight. People want to believe I'm an expert in dealing with mental health issues in children, and I'm not. I just do what I have to do. Believe me, there's many days I wish I was not dealing with mental health issues in children because it's absolutely overwhelming at times, especially over the past year and a half. The article I just mentioned that I did on our website was really done more as a form of catharsis than doing it for the parents, only out of my own frustrations with what I was dealing with in children. I'd say at least half my schedule every day is filled with mental health issues. And usually when I round in the morning at Golisano, any particular week, I have 2 to 4 children who are there for suicidal ideations or attempts. So it's been very, very distressing in trying to deal with this and understanding why this has been happening. It's also very exhausting to deal with mental health issues in children. And if you ask any of my colleagues in pediatrics or even family medicine, they'll tell you that dealing with these issues on a daily basis really is very trying, and it takes a lot out of you. You feel mentally exhausted at the end of the day. So I hope some of the things I'd like to cover with you will be helpful to you. Please ask me any questions. And as I said, this is my own interpretation of things I've been dealing with and experiencing. So it's not meant to be a playbook. It's just really going to cover the way I approach issues when I see children on a daily basis. So the first, I think, is to review what we normally see in children. And children really are always dealing with varying mental health issues by the nature of what they are. From when they're born until they grow up, mental health issues change almost every time you see a child. And I thought it would be important to at least go over the issues that affect children more than it might affect adults at times, because children aren't necessarily as resilient in dealing with things that they don't really understand when they happen. And so, first of all, a child's personality, as many of you know, whether you have your own children or you have family members and friends with children, their personalities change almost daily. When I see babies when they're first born, you can already tell what type of personality they may or may not have. And it changes as they reach each milestone and as you see them at each visit. In my practice, we see children until they're 22 years of age, primarily because I enjoy seeing them through college and try to help them. But it's really quite fascinating to see kids who grow up and mature and develop into usually functional adult human beings. Sometimes, unfortunately, they turn into dysfunctional adult human beings, which I try to do everything I can to help them out once I kind of set them adrift from the practice. But children change radically from when they're born, as I said, until they go through all their stages. It becomes particularly difficult because in children, we deal with other contributing factors. I'm sure many of you know that the rate of autism has clearly been increasing over the years, as well as the rate of ADHD. We've found lately that children seem to be having increasing sensory issues with regards to not just things they wear, but environments they're in, temperature intolerance, food intolerance, a wide assortment of issues. Many children have some issues with developmental delays. I think for the most part, our school systems do an excellent job of assessing children for developmental issues and also utilizing 504 plans or IEPs when they're appropriate. And then finally, and probably the biggest issue, is that children, especially children with ADHD, have many mental health comorbidities, maybe not present initially, but they develop with time, which I'll mention briefly when I get through that. On top of all of that, you add the fact that children commonly have acute and chronic illnesses, ear infections, sore throats. Wendy, do you want control of my screen? Okay. Anyway, children have chronic and acute illnesses, which also affect how they interact with their family members and others. Finally, the domestic and home environment and parental adequacy is also an issue. Parents are very stressed right now, both not necessarily having active employment or working from home, being limited in where they can do where they can go and what they can do. And so the home environments, especially when the children have been home up until very recently, 7 days a week, 24 hours a day with the parents, they get on each other's nerves. And that has been an issue for some. Some families actually have gotten closer together, and they've been creative and tried to do things that everyone enjoys together. And we always try to encourage them to do that. And then finally, and things that we cannot control, are societal, environmental, disruptive events, war, natural events, and pandemics, which is what I guess brings us to this discussion today. Now, normal mental health concerns that we have in children is, first of all, a stress. I deal with kids that come in all the time and complain of feeling stressed and feeling anxious as a result of the stress. And something I mention to children and their parents is that stress is a natural experience and a natural feeling. And stress is the greatest motivator we have. And stress makes us improve our performance, get our homework done, study for tests, do a better job at what we should be doing. And stress is not something that is bad. It is something that pushes us to do things that we don't necessarily want to do. We cannot get rid of stress by either using drugs and that's either prescription or illicit drugs, or telling people not to worry about it. Because when people don't feel stressed, they don't perform. So I always try to educate children and get them to understand that some degree of stress is always useful. And developing ways of dealing with that stress makes them much more effective, not only as a person, but as an adult someday. The problem we've had, though, lately is that children sometimes also have feelings of isolation, both physical and emotional, especially when lately they've been kind of cooped up at home and the parents aren't around and their friends aren't around, and they feel very isolated and they sometimes withdraw. Children also can develop mild depression. Again, I explain to children and their parents that depression is normal in everyone. There's two types of depression. One is clinical organic depression. The other one is situational depression. And we all experience periods of depression, which is normal, but it's how we deal with that period of depression and how we communicate to others what we're dealing with, which makes it different. There is something called adolescent dysthymia, and that's a fancy term for adolescent disease. All adolescents have emotional and psychological disease. You can ask any parent who's lived with most kids going through adolescence, and you don't know which child is going to be there day after day, because their moods are all over the place. They're trying to understand who they are and where they fit into this world. And sometimes they can't control their reactions and their behaviors and emotions. So adolescence is a time when we all, including providers, need to be patient with the kids and give them as much reassurance as we can. As I mentioned before, anxiety is related to stress. And the problems with anxiety is sometimes it elicits adaptive responses, sometimes good and sometimes bad. Anxiety can be crippling for some children, and others it can be motivating. But again, parents and providers aren't always aware that the child is experiencing significant anxiety, and it can manifest itself in such ways as constipation, eating disorders, even anorexia, or other ways that you don't really realize at the time that it's all stemming from true anxiety. Children, again, over this past year and a half, sleep hygiene and patterns have been completely disruptive. Children are staying up very late at night. They have no schedule. They claim they can't sleep, but they're on their phone or pad or watching TV or playing video games to very late hours in the morning. And they go to sleep sometimes at 3, 4 o'clock in the morning and sleep until noon, and miss the Zoom sessions with their teachers. The parents have gone to work, whatever. It's just totally disruptive. So one of the things I've really stressed with parents throughout this whole year and a half has been to try to maintain as normal a sleep pattern as possible, which means getting up at the normal time in the morning as if they were going to school. And then finally, we have general turmoil, emotional turmoil, which occurs regardless of age. And when everybody's cooped up together, again, up until recently, and people all have emotional needs and burdens, it erupts sometimes into major fights within families, which is unfortunate. And it makes all the other issues much more difficult to deal with. Now, the pandemic, which is really what prompted this discussion today and the others subsequently, has caused generalized societal disruption. There have been numerous public health adaptations, which we've all had to accommodate. We've all been struck with the realities of illness and death, especially children. Children, when they see it on TV and they see it within their families and or in their friends, the realities of illness and death become very severe to them. And it makes them worried about their own health as well. And it's a very harsh reality that children, unfortunately, have not had to experience before this time frame. And it's been very, very unfortunate and very disruptive to many of my children that I've seen. It's also resulted in the fear of the unknown. Children need to have stability and emotional support at all times and whenever possible. And when they see that illness and death can occur anytime, especially with an unknown cause like COVID has been, something they can't see, hear, or feel, it brings to them the fear of what used to be called the boogeyman, somebody that would come into their lives and disrupt everything and take them away or cause the loss of people they know. And so this unknown germ that we've all been dealing with has been very difficult for kids to understand. The social isolationism has been something we've all experienced difficulties with, even myself. It's been very difficult not being able to see family members and friends on a regular basis and doing things we got so used to doing. It's resulted in obvious significant lifestyle disruptions and changes in family dynamics. Now, spouses are together and sometimes they don't like being together as much as they really would like to be. It causes family arguments. And fortunately, for some families, it sometimes draws them together, especially if they try to get creative and try to be more tolerant of each other's behaviors. There was a study done recently looking at COVID-19 and the effect it's had on student mental health in colleges. And this is very interesting, especially at the end point. Clemson University did a survey of 2,500 students in 7 public universities in the spring of 2020. 85% of those students surveyed had high to moderate emotional distress as a result of the changes they were undergoing. The most at risk were women, Asians, those under 25 years of age, those in poor health, and lower income students. And they've also found that spending 8 or more hours in front of computers, smartphones, or TV screens also increase the risk. And these issues obviously affect most children at some point during this past period, because either children are on Zoom sessions and computers or on iPads or other devices to keep them busy and keep them occupied. So it seems like it's had a very significant effect on socialization and an increasing level of anxiety in children. The end result of all of this is stress. And stress is described as feelings of fear, anger, sadness, worry, frustration. And some people feel psychological numbness, like you don't really feel, you just are going through each day as though it was the day before and nothing seems to change and just feel numb and just carry out the daily activities. I know I have felt that every day. What gets me through my day is that every child I see is just a new challenge, and I enjoy seeing the kids, and it actually keeps me interested in what I do. Fortunately, I do medicine. I love medicine, and it's kept me preoccupied in dealing with all these things. Stress can also change appetite in children, and that's up or down. We've seen many children gain weight. We've seen some children not gain weight, and some children, as a result of the stress, have developed anorexia. We've seen an increase in anorexia in children lately. Their energy levels have also varied and gone down, and they seem to lose desires and interests in things that they typically would do, whether it's sports or hobbies or other things. Kids and parents had difficulties with concentration and making decisions. It's been very disruptive for my kids with ADHD. And some kids have sleep disruptions and nightmares at night, not necessarily pandemic specifically related, but nightmares in general. We've also seen an increase in night terrors in children, which they get up in the middle of the night, they get out of bed, or they start screaming, and they're not even aware that they're doing so. There's also physiologic reactions to the stress we're all experiencing, including headaches, body pains, and GI symptoms. And that can be either diarrhea-like illnesses or vomiting, abdominal pain, or even constipation. We've also seen an increase in chronic health problems, especially mental health issues. And finally, we've seen an increase in substance abuse, especially in the older adolescents. So increased tobacco, increased vaping rates, alcohol, and drug use. It's been worsened, I think, lately. I'm not taking a position on the legalization of marijuana, but I think my older adolescents feel that it's completely acceptable at this point. So I try to talk to them whenever I can about that subject. In children, the issues that primarily affected them have been that they've been isolated from their friends as a result of school changes, which most of the kids have been very happy about getting back to school over the past few weeks. There are still some school systems which are doing things remotely, but for the most part, I think they've tried to get the kids back together again. It's had a positive influence on them. Before they did go back to school, though, I think the remote learning responsibilities have been burdensome for some kids, again, especially for those kids with ADHD. Trying to sit still and pay attention to a screen and doing what they're told to do has been very difficult for some. We've seen an increase in anxiety and adaptive responses. We've seen an increase in obsessive compulsive disease in the kids who are anxious, kids who have increased oppositional defiant behaviors, mood disorders, insomnia, as I mentioned, aggression, and what I've called room hibernation. There are a lot of kids that stay in their room, lock the doors, or don't want to be bothered and just stay in there day after day after day and just come out to get food, go right back in their room again. I've done whatever I can to try to tell parents how to deal with that, but it's been difficult for some children. As I said, we've seen changes in eating habits, and we've seen either weight gain or weight losses. Children, especially the adolescents, have had feelings of despair and hopelessness, especially magnified when they have other mental health issues. And then finally is the unfortunate issue that I mentioned earlier, and that's about self-harming behaviors, including cutting and suicidal ideations. It's got to be every other day I see a child who's demonstrated some cutting activity. And cutting, for those of you who don't know, are generally the marks that are made on the arms and legs, usually using a short device like a razor blade or paper clips or kitchen knives, which they make marks on their skin, sometimes very deep, sometimes not so deep. Typically they're superficial. And the reasons they do cutting, from what I've learned from the kids themselves, is that number one, it sometimes is a sign that they need help, and is a signal they're trying to tell people there's something wrong and they're hurting inside. And for some kids, it's actually gives them a sense of relief. The actual pain that they feel, the discomfort, actually, whether it's related to endorphin release, which are natural opioids in the brain when you get hurt, or whether it intensifies their emotions, they do get some relief from it. They realize it's harming their own skin and can result in scar formation. They really don't want to be doing it, but they feel motivated to do so. It's not that unlike very young children who bang their head against doors or walls or headboards when they're frustrated. And unfortunately, for the most part, whether intended or not, it's a cry for help. So what we do in pediatrics is we look for stress signaling that children can manifest. We look for changes in communication, especially with their parents, their brothers and sisters, other family members like grandfathers, grandmothers, and uncles and aunts, and even their teachers. Teachers are very good at perceiving whether children are regressing or are isolating themselves. And they've been also very good, I think, over this past year to communicate with the parents and sometimes with us as well in the office. We always watch children for what I call stress stigmata. As I mentioned, cutting before. Children that now have poor hygiene, they don't want to take showers, they don't want to wash their hair, they don't want to wash their face. It's very important to look at the drawings that a child makes, because the drawings sometimes give you a lot of information on what the children are thinking. You can also look at their writings. Not many kids have diaries, but I found that kids who really are going through some emotional turmoil tend to write things about how they're feeling. It's important to take a look and see what they're writing, and if the things that they're writing are alarming in nature, we should know about it. Substance abuse, as I mentioned, has increased, and it's just a tough thing to deal with. We've also found that some kids, when they're home all the time, because there's usually alcohol present in the home, the adolescents have been using the alcohol in the house. And finally, we look for behavioral changes. Kids that are just not the same child they were before, whether it's the result of substance abuse or otherwise, it's important that you tell the provider that what's going on, and perhaps we can intervene to try to help the child. The biggest issue for me has been seeing children who withdraw and demonstrate disinterest in things they normally had interest in, especially sports. I've seen kids that used to love playing baseball or basketball or football, and all of a sudden they don't want to go practice anymore. They don't want to be on the team, and that is problematic and tells me that the child's really dealing with some issues. I talked to you about room hibernation. There's another called emotional hibernation. This is when the kids just kind of close down, don't want to talk about how they're feeling or what they're going through, and it's very, very difficult to sometimes deal with that. Today I had to see a 14 and a half year old boy who just came back, and he was considering hurting himself. He did cutting this past week, and it was very, very difficult for me to draw out from him what he was feeling. I finally opened up, but it took quite a bit of time to really talk to him and try to get him to express how he was feeling and what he was dealing with. Then finally, changes in sleep pattern. And that's either kids that just cannot sleep at night, or kids that just want to stay in bed all day and just sleep. And we see that classically with depression in itself, but it's been very disruptive in kids. And if children have issues like ADHD and they're not getting adequate sleep, all it does is make that issue much worse. So how do we intervene with this? First of all, it's not easy, and it takes a lot of effort, and it is very draining on providers, just as much as I'm sure it is with counselors and psychiatrists and teachers. But we have to do it because the kids need help. So we try to communicate on a regular basis with children. I try to get the parents to do the same thing with them at home. The best thing to do is at the end on the top where I mentioned family meals. Families rarely have meals together anymore. And family meals used to be a time, especially for dinner at least, in which the parents can talk to the kids and find out what they're thinking, what they did for the day, what they'd like to do in the future. And it was always a good way to open up communication between parents and children. But I don't see enough families doing that, unfortunately, especially again over this past year. We also try to make sure that the child has daily routine structuring or reorganization. Now, what I mean by that is it's good for children to have a daily routine. And that means from when they get up in the morning, getting ready for school, whether it's on Zoom or in person, and then getting their homework done, maybe at the end of the day, relaxing with the family, doing something together, and then going to bed. However, the other thing I've told parents, it's also very useful to reorganize the daily structuring. And what I mean by that is adding some randomness to it, mixing things up a little bit, because daily routines get very boring. And to do things in a fun way with the kids sometimes makes it much more enjoyable and more interactive. Sleep hygiene, I know I keep harping on this, but this has been the biggest issue I've had to deal with most of the kids. Other thing I've mentioned, and I do it sometimes on my website, and I tell parents to do so, is try to develop some individual and group activities, both active and passive. And what I mean by passive is even let kids read a book and then tell you what they read about, or even have them write down a review of what they did and what they liked or didn't like about the book. Kids also need free time and unwind time. We can't let kids be automatons and make them do homework all day or make them do chores all day. They need some free fun time. If it could involve either their siblings, friends, or parents, it's even better. And finally, utilize community activities. I realize over the past year, it's been very difficult to deal with this because community activities have been so limited, but things like club, church, school activities, and organized sports hopefully will be very helpful to the kids in the near future. So when you see a child, whether it's your own child or someone else's child, let's say in a school setting, that needs intervention, the first thing you need to do is make sure that the child's provider becomes aware of it and that an evaluation is requested. Mental health counseling is extremely important. The problem we've had as providers is finding adequate mental health counselors and doing it in person if possible. Kids really don't like remote counseling. I hear that uniformly, but again, over the past year, finding counselors who would do it in person has been difficult for all of us. The suicidal ideation or intent requires immediate evaluation and intervention and close monitoring of psychotropic medication use. Kids who are on psychotropic medications um, whenever I prescribe medication for a child, I always worry about it because a lot of the medicines we use are very, very dangerous. And if they take a relatively few extra pills, it can result in a cardiac arrhythmia or other issues for the child. And so I get very nervous anytime I dispense these medications. However, if we have a child who's discussing with the parent or the counselor that they may want to hurt themselves, we generally request that they go to CPAP or go to Golisano to be evaluated by psychiatry, or they come in immediately to see me or one of my providers to try to find out what exactly is going on and if the intent is there and if they have a specific plan, which is the critical issue. As I mentioned, we've seen increased substance abuse, which absolutely requires intervention. You cannot ignore it, but substance abuse only seems to exacerbate the pre-existing mental health issue. Cutting and self-harm behaviors, again, it's help signaling, or as I mentioned, it's emotional pain relief, but it needs to be dealt with aggressively. And then finally, I have an acronym that I use, and this is the approach I take. It's called LEADER, and it means to listen and to evaluate a child for what's going on, affirm that the issue is real, that it's not just made up, and you don't blow it off. You try to diagnose exactly what is going on with the child while empathizing with the child for what they're feeling and what they're going through. And then finally refer if it's an issue beyond what we can do as providers. And again, that issue has been tough for us. We haven't had a lot of support because there just are never enough counselors or psychiatrists to take care of all the needs that we've had. So I think that's the end. I try not to have too many slides for you, but I'm more than happy to try to answer any questions for you if I can.
Thank you so much, Dr. Dracker. I really appreciate your presentation, and we do actually have a few questions coming in. I would also love to encourage anybody that has been listening to go ahead and enter your questions into the chat, and I will collect them and then read them for Dr. Dracker. So once again, thank you so much, Dr. Dracker, for that presentation and for sharing your experiences and your observations of what it is that's happening right now. I think that openly sharing this is so helpful for many people who have been managing and seeing young people that they care about, and to hear you affirm that and to also offer some resources, I think is really a gift. So thank you so much for doing this on behalf of our community. So I do have a question from an audience member that builds on actually your last statement that you were just speaking about there not being really enough providers. So the audience member wrote in to say there seems to be a big increase in the need for therapy for children and may be difficult to find practitioners with openings, especially those in network with insurance. What recommendations do you have for finding appropriate services for children promptly?
The biggest issue I really think is that there needs to be greater recognition on the need to support the efforts of mental health providers. And, insurance companies commonly don't always support psychiatric services or mental health services. And depending on the insurance and the level of reimbursement, unfortunately, some counselors and psychiatrists don't see children with certain health insurances, and so we're very limited on where we can send children and how soon we can get them in. So, unfortunately, we have very long wait times sometimes to get the kids into, and there's just not enough counselors to go around, and counselors burn out just like everyone else burns out, and especially lately. So I think there needs to be greater recognition that mental health issues in people in general, not just children, is as significant a disease as cancer. And I think it needs to be covered and recognize that mental health providers need to be reimbursed appropriately for the efforts they put in. I mean, when you see a child or an adult, it's not like a 10, 15-minute visit for sore throat. It's a prolonged visit. And that should be reimbursed appropriately. And the parents don't necessarily have the funds available to do these therapies. And it's problematic at times.
Thank you for that answer. So I have another question to kind of build on that, which is, at what point do you think parents should seek mental health supports for their children, in terms of distinguishing between like normal growing pains or ones that need professional medical attention? Do you think it should be something where the mental health is an issue that is brought up in children's regular visits? Or how do we kind of like change the culture or the nature of being a caretaker or a parent to make that an important aspect that our providers are aware of?
I think a general should always involve the provider. And that's because most healthcare plans need a referral to a mental health practitioner. And also the provider should be aware of what's going on with the child, because sometimes the counselor may suggest starting the child on a medication for whether it's anxiety or depression. And it's very helpful to have a working relationship with the counselor who's seeing a particular child. So I would always at least start with the child's provider.
Okay, thank you for that. Can you give some advice on what caretakers or parents can do in that gap between being able to, for example, get their child to a counselor or a mental health provider if there is a wait time or if there is something else? What are some things, what's some advice that you might offer?
I think just communication and letting the child know that the parents care and are concerned with how they're feeling. It's a big burden that parents have sometimes because, if your child's having some signs of symptoms of a significant mental health issue, parents get very concerned and afraid, and either try to clamp down on the child or ignore the issue because they don't know how to deal with it themselves. But I think in the meantime, um, communication and reassurance are probably the best things to do for a child. I mean, love doesn't cure everything, but it goes long distance in helping a child feel more secure and understood. So I think just be a parent and just listen to your child and find out what's really bothering them.
Thank you so much for that. I was really curious to hear more about room hibernation. You mentioned that you do give some advice to parents in terms of attempting to draw children out of that state of being. I was wondering if you might be able to share that with us.
Well, I think Zoom sessions has really made a child's room self-sufficient. Many of the kids do Zoom sessions in their room with their laptop or PC, and they set themselves up in the room, whether it's with their books or food and everything else. And their room has become their own little womb where they have everything they need in the room and nobody bothers them. They can do what they want either before or after Zoom sessions, and they stay in the room and nobody bothers them. And they withdraw, they don't communicate, and the parents really don't know what's going on in the child's life. And some of the kids rather be in an environment like that and not be bothered by anyone. And some kids do it and some don't. I think every day I hear from a parent, he just goes in the room, doesn't want to come out, except when it's for dinner sometimes, if he's hungry. And so it's something we've seen a lot of lately. And it's something, unfortunately, because parents are busy and they're dealing with their own issues, it's easier for parents just to let them stay in their room and not bother them. I understand that. But it's not healthy for the child or the family to do that all the time.
I have a question that builds on that one, which is, you mentioned in your presentation that it's quite draining on you as a provider as well to be constantly seeing children through these challenges. And, it's very challenging for parents too, right, to be dealing with these issues day in and day out. So I was wondering if you have any advice for parents who may be managing their own mental health struggles as well as with their children's.
No. I, I don't know how I deal with it every day. So I don't know except to just, talk to your friends and your spouse or partner or anyone you need to. It's just there's no easy answer except to do things to take care of yourself. They're always telling us lately, organized medicine has tried to reinforce the fact that providers need to avoid burnout and be good to themselves and take care of themselves. And, unfortunately, most providers interpret that as meaning I'm just going to retire and not do this anymore because I can't take it and just go off and have a second career or do something different. But it's tough. There's no easy answer, and except to try to rely on people that you enjoy being with. Again, this pandemic has made a life more difficult with that regard. But hopefully, as we all want things to go back to normal, things can normalize for all of us, and we have normal relationships again with our friends and family. But I don't have an easy answer for that.
Thank you so much for your honesty. I personally appreciate it. And I can see from some of the folks who are listening in, they are nodding in agreement and recognition. And again, I'd like to invite anybody who has any questions for Dr. Dracker to go ahead and put those in the chat. We would love to hear anything more from you.
Jess, Wendy had a question to everyone, and I can answer that for her. When will young children be able to receive the vaccine for COVID? I have two grandsons. Mason is 8 and Ethan is 3. In all likelihood, next week we will be going down to 12 years of age with at least the Pfizer vaccine. Moderna is only a week or two behind. And so I expect in June we'll probably have approval for over 2 years of age. I know the study is being done down to 6 months of age. I don't know if the FDA will give initial approval for that right away. But I think next week will be a starting vaccination for 12 and above. And I would assume in June, we'll go down below 10 years of age. Parents, from what I've seen from parents have been okay when the kids are 12 and above. A lot of them have expressed concern under 12 years of age with regards to them getting it. I've seen no data so far because I worked with the FDA as well. And I've seen no data that suggests that the vaccine causes any complications in children. If anything, they seem to tolerate it better than adults do, seem to have fewer side effects. This is in the 16 years and above, but fewer side effects, and they seem to have actually better immune response than adults have. They have a higher level of antibodies, and they seem to be more durable or longer lasting. So I don't have any real concerns right now with children getting the vaccine, but we'll wait and see all the data when it comes out.
Thank you so much for that. And thanks for grabbing Wendy's question. It had moved up my screen and I didn't quite see it. And I have a follow-up question about that. I read an article yesterday that said that Pfizer was going to be seeking emergency approval to have it approved for children 2 to 11. Do you know if there are any ongoing studies about those yet?
Ongoing studies with regards to what?
Around just vaccination in children and what those studies may be showing yet.
Well, all the studies are looking at immediate and subsequent side effects. The studies that are being done in that age group are phase 3 studies, which are very large studies. I think the one being done is 8,000 children, and they look for immediate and delayed reactions to the vaccines. And then they're studying them for both to see whether they develop infection, because as you know, some adults at least have actually gotten infected after they received both vaccines, but the disease experiences have been mild. So they'll be watching that in children. I know in some groups they're also going to be watching antibody levels to see how long the antibody levels persist to the point where they're virucidal or preventing true infection. So the data accumulation will be ongoing in all the groups.
Thank you so much for that. We have a comment that came in from Amy, who says, I would like to thank you, Dr. Dracker, for your commitment and dedication to young people. It's wonderful that you spend so much time truly listening to the kids.
Thank you, Wendy, Amy.
So Lisa also wrote in and said, agree, Amy. He is fantastic. And I speak from a personal standpoint since my child has been seen at this practice for years. Thank you, Dr. Dracker.
You're welcome, Lisa. And you can have any appointment you want.
So everyone just tell the office that you're Lisa and you'll get right in, I guess. Dr. Dracker, thank you so much for your time and for your honesty and for your commitment to children and to so honestly and openly sharing information and your perspective tonight. And before we wrap up, unless we have any other questions, I would just love to invite you to share any closing thoughts or things that you'd like for us to take with us.
Thank you. Hope I can help you some. So
All right. Well, thank you so much, Dr.
you're
Draker.
welcome.
And I would love to say that we will be sending out an email follow-up probably tomorrow to everyone that attended. We will have a link to the recording of this if you would like to share with anything. And then any additional resources, for example, how to get in contact with Dr. Draker's practice and any other resources that we can share with you. So please do reach out if you have any questions. We are happy to support you here at the Y. And I just want to thank everybody for logging on and also Dr. Draker for a really informative, generous, and open-hearted session this evening.
Thank you. Thanks, Jess, for doing it.
Good night, everybody.
Good night.